May you all be blessed with peace, kindness, and blessings from Allah. Welcome. I would like to start by apologizing for the delay in posting new episodes, as I have been extremely busy lately. By Allah's grace, I will do my best to be on time to post new episodes weekly. Let's go, we have arrived on time for our weekly meeting. Today's episode is titled Alopecia areata. What is alopecia areata? How does this condition develop, and what are its symptoms? What triggers the body to show it? Is alopecia areata contagious? Is it chronic? Does the condition disappear and then reappear? What are the steps to treat this disease, whether simple or complex cases? What are the latest approved treatments? And what are the updates on the treatment of alopecia areata? Wait for me. Peace be upon you. I am Hussein Lotfi, and you are following the Octopus Pharmacist's channel and a new episode from the episodes of From A to Z Derma. Welcome to you. In the beginning, those are the titles of today's episode. If you need to know a specific title, accelerate the video to the minute it starts. But if you need to know everything about alopecia areata, stay with me from the beginning to the last minute. Come on, let's start by taking a general idea about alopecia and knowing what this disease is and how it happens. The word alopecia means hair loss, meaning that it is not considered a disease in itself. It on its own, it only tells me that there is hair loss, but after the word alopecia, another word must come to explain to me the meaning of the word alopecia, its form, cause, or type. Here comes the second word. It is the alopecia, or patch or spot, that appears on the skin, and hair loss occurs with it. What is special about alopecia areata is that we call this spot non-scarring, which means it is the spot where hair loss occurs. The skin is healthy, meaning I will not find pimples, inflammation, pus, itching, or anything else. Completely clean skin. The next point, what is the cause of hair loss in this patch? The cause is basically an autoimmune disease. What is the meaning of the word autoimmune disease? My immunity is supposed to be created by God to protect me from bacteria, fungi, viruses, foreign bodies, etc., but with the changes that happen to a person, such as anxiety, stress, sadness, distress, excessive thinking, and sleep disturbance, there is a disturbance in my immunity. Instead of protecting me, this immunity is starting to attack certain areas of the body. With this disease, the immunity attacks a spot on the skin and causes hair loss in that spot. Alopecia is one of its features, which is that it reappears, meaning that the person is treated and the hair grows, and again after a while, hair loss may appear in the same place or appear in another place, and so on. The rates of reappearance with alopecia areata are 2 orders of magnitude higher. The next and very important point, I wonder where alopecia appears? The truth is that the disease can appear anywhere in the body, but the most common place where alopecia is seen is the head area, which accounts for approximately 67% of cases, followed by the chin area, which accounts for approximately 28%, followed by the rest of the body, such as the hands, feet, sensitive areas, etc., which accounts for approximately 2% of alopecia cases. Alopecia is a general word that includes 2 or 3 important types. First, the word alopecia is the same. It means that I have a small spot. Its diameter is approximately 2 centimeters, it can be a little larger or smaller. 1, 2 or 3 spots can appear in the same place and their location is clear and fixed. However, we also have 2 very important types of alopecia, which are alopecia totalis, which means that hair loss has occurred on the entire head, meaning the hair on the head and the hair on the face as well. As for the last type, we call alopecia universalis, which means hair loss has occurred on the entire body, whether on the head, hands or feet. As pharmacists, we are allowed to deal with cases of alopecia, which are the small spots that appear on the face or head. The next point, what are the vital signs? What are the things that the doctor looks at to confirm the case of alopecia? Be careful because these points are very important. The first thing the doctor will ask about medical history? Did these spots appear suddenly, or did they appear over a long period? Alopecia appears suddenly, someone comes to shave their beard and finds a spot there, someone shaves their head and finds a spot there, meaning it appears suddenly. The second point, the doctor starts examining the spot, he will find the spot area clean and free of inflammation. We are still saying that it should be non-scarring, meaning there will be no pimples, inflammation, crusts, pus, etc. And keep in mind that rarely in some very few cases, at the beginning of the appearance of alopecia areata, there is a slight, strong stinging sensation, Then it disappears and the person does not feel it. The point after that, the doctor starts examining the edges of the spot. He will find very normal hair on it. The doctor will start to move to the next step, which is that he will start examining the hair follicles using a dermatoscope. He will find something very distinctive that we call yellow spots. What are these spots? The answer is simply that when the immunity starts to affect the hair in the place of the follicle itself, sebum and keratin or this mixture begins to collect in it, giving us a very distinctive yellow spot with alopecia, and this happens in 95% of cases. This is one of the very distinctive things in alopecia. The next point, the doctor starts examining the spot. He will find how many hairs are still present on the spot. How many of these hairs will he notice? One or two that take the shape of an exclamation mark. What does it mean? He finds that the hair at the roots close to the skin is strangled by two, but at the ends it is thick and coarse, so they call it an exclamation mark hair. This point is very distinctive with alopecia. The last point in the distinctive signs for diagnosing the disease is the appearance of some signs on the nails, something we call nail pitting. This appears before the appearance of alopecia for a period that may reach 2 or 3 weeks, and the reason behind it is an immune reason, and its percentage sometimes reaches 70% of cases. The second and very important topic with us today is how to distinguish alopecia from other well-known diseases that can actually be confusing in appearance. The first thing is the case of tinea capitis or tinea that appears on the scalp. The appearance can be confusing, but I have a few points that are very distinctive with alopecia. The first thing is to look at the nature of the spot itself. The nature of the spot in the case of alopecia is clean, non-scarring, and has no problems, but with tinea, I do not find scales, I find itching, I find inflammation, and sometimes due to the person scratching, bacteria can be transmitted to the spot itself, so I find purulent foci, so from the appearance I distinguish the two from each other. The second point is to take the medical history of the person in front of you. In the case of tinea, this person will have dealt with the tools of an infected person, for example, through barbers, or he may have dealt with animals, or he may have had a translocation, meaning he has fungi in his body that he scratched and then went to scratch his head, and the fungi moved from his body to another place, which would be the scalp. However, this does not exist with alopecia. What is the medical history of a patient with alopecia? The subject of anxiety and tension that occurred a very long time ago, which could reach 2 or 3 months, and the immunity goes and attacks the hair spot. The third point is to start looking in the spot in front of you. In the case of alopecia, you will find that almost all the hair is gone, but in the case of tinea, no. You will find that there is still hair present and clearly. The point after that, I start looking in the hair and I find the exclamation mark. I find it with the alopecia, but it is not present with the tinea. Finally, I find the yellow spots with the alopecia, but it is not present with the tinea. The second disease is hereditary hair loss or androgenetic alopecia. Let's take a few points to distinguish it from alopecia. First of all, the shape. In the case of alopecia, I find spots that are circular or oval in shape, very defined and clear, and the hair on the ends is healthy. It happens suddenly, but in the case of hereditary hair loss, does it happen suddenly? Someone like me goes to sleep and wakes up to find that he has hereditary hair loss? Of course not. In the case of hereditary hair loss, the condition occurs over a long life, many years, and gradually, but in the case of alopecia, it happens suddenly. The second point, in the case of hereditary hair loss, it takes a distinctive shape, a shape that is symmetrical, meaning I find the right half like the left half. Does this happen with alopecia? Of course not. I find 2 or 3 spots, may be present in the right half or the left half, or they are developed and do not take a distinctive shape or pattern, as happens with hereditary hair loss. The next point, we start to take the subject of yellow spots and see it is present with alopecia. We look at the shape of the hair that is present in the place where there is hair loss and we find the exclamation mark hair present with alopecia. Finally, in the case of hereditary hair loss, the hair thins over time, meaning that the person who will suffer from hereditary hair loss will not find the hair falling out very thickly in a short period. This is what happens in what we call gradual thinning, meaning the diameter and density of the hair with the case of hereditary hair loss occurs gradually, but in the case of alopecia, no, the hair itself falls out suddenly. The third disease that might confuse me, and we hear this from its name, is triangular baldness, meaning I have a triangle where hair loss has occurred. Where does it occur? Does it occur on the head, and at what age does it occur in children? So I have this disease, one of the things that might confuse me as well. The first thing I look at is age. Temporal baldness occurs in children, while alopecia areata usually occurs in adults and rarely occurs in children. Point 2. Look at the spot. In alopecia areata, it is circular or oval, but in alopecia areata, it takes the shape of a triangle. The third point, temporal baldness occurs in one side of the head, but this topic can also confuse. The point after it, start looking for the exclamation mark hair. We will find it present with alopecia and not present with this condition. Since we are talking about the condition, here is some information about it. This condition does not need treatment at all. The condition of tummy tuck is a type of self-limiting disease, meaning that the condition will return to normal without treatment. We only need vitamins and minerals, and the child will sleep normally. With time, the hair will grow back naturally within 2 or 3 months without any medication. The third and penultimate title we will discuss today is what are the steps to treat alopecia? Before I tell you the steps, you should have a few very important points in mind. First, alopecia is an autoimmune disease, and the case will recur, meaning that the person may be treated and the problem will come back again, as I told you at the beginning. The second thing is that alopecia disappears even without treatment, meaning that the hair will be replaced even without treatment, and this happens approximately within 4 to 6 months. So why do we take treatment? The answer is to accelerate hair growth, because if the problem is in the face or head area, it causes a psychological crisis for the patient, but if it is in a hidden place, we tell him not to take treatment, and the disease will be treated on its own. The next point is that whether with treatments or the disease is cured on its own, the hair grows back again by 80 to 90%, and this does something we call camouflage, which means it covers the spot and returns the shape almost normal, and the problem disappears. The last point, which is very important, we should note that in many cases, when the hair grows back to its normal state, white hair appears in this spot, and this is something very normal and natural, so reassure the patient. Okay, sir, tell me now what the treatment steps are. We said that this disease is one of two things, either a simple disease that will respond to the treatments we will discuss in detail, or it is resistant to treatments, meaning it does not respond to treatments. Well, responding to these treatments, what does it mean? It means that it returns almost to normal within a month or 2, but I continue with a full line of treatment for 4 months to reach more than 80 to 90%. But if the patient completes 4 months of treatment and there is no result, then this disease is resistant to treatments. What are the treatments the patient will use in case of simple cases? 4 lines of treatment. First, the disease is autoimmune, so I need to put something on the skin that will lower or suppress the immunity. And here the best thing to use is topical corticosteroids that are available in the market, like solutions such as Bitnovate or Dermavate solutions, and if the solutions are not available, the patient can use a cream. But ointments are not a better choice. Stick to either a solution or a cream. The second point with cortisone is it good to use tablets? No, why, even though they lower immunity, but to reach a high concentration to cause a great effect on lowering immunity and skin spots, I will use very large doses, and I will terrify the person with many side effects. The second line of treatment is that you need something that increases the blood supply, which supplies the skin with huge amounts of blood that contain a high concentration of growth factors, which are important to regenerate the hair follicle quickly. So, how do I do this? I do it through compounds that we call contact allergens, meaning they themselves cause sensitivity in this place. When they are applied and cause sensitivity, and the result is increased blood supply. Of course, there are many products in the past, but the product, which is still available now and effective, a very good product from Ducray, we call gel rubefacient. The third line of treatment that we use is minoxidil 5% for men and 2% for women. Now I know that you will tell me, you see people taking 5% and using it for women. There is a mix-up, very large in this point, and in many studies on this point, the conclusion is 2% for women and 5% for men. This is the correct choice. If a woman takes 5%, she will not take an additional effect, but she will take side effects like increased hair growth in the body, like in sensitive areas in the face, an increase in the heart rate, high pressure, and difficulty sleeping. So let's always stick with the correct doses, and it must be confirmed that 2% will be a good choice for women, and 5% will not bring more than results. So, what does minoxidil do? I mean the mechanism of action. It is said that it increases the concentration of growth factors in spots of alopecia areata. The fourth line of treatment is the two most important things to increase hair nutrition are zinc, preferably zinc gluconate above 50 mg, and the second thing is biotin. at a concentration of 5,000. These are the 4 steps that I do in the case of alopecia areata if I see the person with a good response within a month or 2 months, so complete the treatments for a period of 3 to 6 months in order to get the maximum benefit from the treatments, but after 3 or 4 months there is no result, so this case is a resistant case, and you must refer the case to the dermatologist. The dermatologist will select one of many options that I will tell you about. The first step for the dermatologist is that he injects intradermal cortisone, triamcinolone acetonide, and the truth is that some doctors like this step to be the first step with the steps of the regular treatments that we mentioned before. How is this done? The doctor injects a cortisone injection with a concentration between 2.5 mg or 5 mg or 10 mg per 1 milliliter and injects according to the square centimeter. Every square centimeter need about 0.1 milliliters, which is 10 units. With an insulin syringe, inject and repeat the dose every 2 to 3 weeks, depending on the response. The second choice for the doctor, which is he uses PRP, platelet-rich plasma. What is this plasma? The doctor takes a blood sample, then separate the content by centrifugation and take the plasma. With the same method of cortisone injection, inject plasma by 1 milliliter for every 1 square centimeter of alopecia areata spots. What is the benefit of this plasma? Plasma contains very high concentrations of growth factors, so it increases the growth rates of hair in very short periods. The third choice for the doctor, which is radiation therapy, which called PUVA, Sorelin ultraviolet A, at which point a substance that we put on the skin and expose the spot to a device that produces ultraviolet light to the place, so the Sorelin will begin to absorb the ultraviolet and begin to cause strong sensitivity in the place. This will increase the amount of blood that reaches the skin, carrying growth factors, plus UV can modulate the immunity under the skin, and by reducing the effect of immunity, the regeneration of hair will be maximized. According to the dose and repeating of PUVA, we need between 20 to 60 or 80 sessions in a maximum of 8 months. The last choice for the doctor is to use medications that reduce immunity, such as cyclosporin or methotrexate, but this step has been postponed now with the emergence of new treatments that bring good results. Very well with alopecia. The fourth and penultimate title, what are the new treatments that are available in the market and that have been approved in the past 2 or 3 years? The truth is, we have 3 very important treatments. And they are very, very good, but when do we use them? We keep them to the treatment-resistant cases and the steps that we mentioned to them. We have baricitinib, which is known as Olumiant, we have tofacitinib, called Xeljanz as a trademark, and ruxolitinib, which is known as Jakavi. Which is better with alopecia? Baricitinib. As for the doctors who watch this video or the pharmacists who watch this video, what are the few important points that you must know about these medications? Look, sir, the first thing regarding the dose of baricitinib is taken between 2 and 4 milligrams. The second important and critical point, before using baricitinib, is a must-do blood test if you find hemoglobin less than 8 grams/dl, avoid initiation or interrupt dosing until hemoglobin reaches greater than or equal to 8 g/dl. The second point, absolute neutrophil count, ANC, if ANC less than 1000 cells per cubic millimeter, avoid initiation or interrupt dosing until ANC greater than or equal to 1000 cells per cubic millimeter. The third critical test, which is estimated glomerular filtration rate, you should check the kidney functions. If mild, EG for 60 to less than 90 milliliters per minute /1.73 square meters, no dose adjustment required. If moderate, EG for 30 to less than 60 milliliters per minute /1.73 square meters, reduce dose by 50%. If severe, EG for less than 30 milliliters per minute /1.73 square meters, not recommended to use. To the pharmacist, you must be aware of every point in the treatment medication, due to the patient contacting you more than the doctor. If any signs of infection appear on the patient, you must stop treatment and refer the patient to a specialist directly. And the most common infection is an infection of the respiratory system, meaning if this person has a cough, sneezing, spray, or fever, stop treatment and refer to the doctor immediately. Now you must ask me about the mechanism of action. These treatments work by a mechanism. Very famous, we call it JAK, Janus kinases pathways inhibitor, and you can say that it is a language of signaling between immune cells and each other, between cytokines and each other. When I cut off the language of signaling this, I stopped the immunity. Yes, I will get the advantage that the immunity will no longer hit the skin, so there is a chance for the hair to grow again. But at the same time, you stop the immunity that protects the body, So if an infection occurs, it will be severe on the patient. The fifth and final title with us today: what are the most important education points that we should convey to the patient or to the people? The patient's surroundings are the first and most important point. We should teach the patient that your disease is not contagious. That means living normally will not transmit this disease to your children, your wife, or anyone you live with. It is normal and not contagious. The second point is that this disease is an immune disease, so be careful of your psychological state. The issue of anxiety, tension, sadness, and distress is the main cause of recurrence. The third point is that you must know that this disease disappears on its own. Yes, it may appear again, but be aware that if the disease comes back, the hair will return completely normal within a few months. As we said, within 4 months, it is approximately 80% curable. You must know that this disease may recur in the same place, or in another place. The issue of recurrence of this disease is one of the signs or the features of this disease. This disease does not affect general health, so live normally as you want and work normally and live your life completely normally. There is no effect on another place in your body. The point that after it is the most important point with people who have alopecia areata, which is the psychological state, the state of depression that the patient can get and the sadness when someone looks at alopecia areata or someone asks, "What is the problem with you?" This situation greatly increases the psychological pressures on the patient, so let's be kind to these people so as not to increase their tragedy. The last point you must warn the patient about is that with the treatments that he uses, it is very normal for white hair to appear in this spot, or it may return to normal, but we assure him that this is normal with his condition, alopecia areata. I want to say enough today, and God willing, next week there will be a new title. I hope that I have provided you with new and useful information. Finally, if you like the content of the video and the channel, don't forget to like, subscribe, and share. Also, don't forget to support the channel on Patreon and PayPal and also on YouTube. Stay well, Hussein Lotfi.